Hello everyone, now let us discuss about 2023 CPT coding guidelines for qualified non-physician healthcare professional online digital assessment and management services. This comes under the medicine chapter of CPT. These services are patient-initiated digital services with qualified non-physician healthcare professional. These are the patient-initiated services, digital services with qualified non-physician healthcare professional that requires qualified non-physician healthcare professional patient evaluation and decision making to generate an assessment and subsequent management of the patient. And these are not for the non-evaluative electronic communication of test results, scheduling of appointments and other communication that does not include the evaluation and management. These services are not for the non-evaluative communication, that is test results, scheduling of appointments or other communication that does not include E&M. While the patient's problem may be new to the qualified non-physician healthcare professional, the patient is an established patient. These are done for established patient only. But the problem might be new. Patient initiate these services through Health Insurance Portability and Accountability Act, HIPAA, compliant, secure platforms such as through the Electronic Health Record portal, EHR portal, email or other digital applications which may allow digital communication with the qualified non-physician healthcare professional. These services are reported once for the total cumulative time devoted to the service during a 7-day period. They are reported once for the total cumulative time devoted to the service during a 7-day period, and the 7-day period begins with the qualified non-physician healthcare professionals initial personal review of the patient's generated inquiry. It begins with that day, and it includes the review of initial inquiry, review of patient records or data pertinent to the assessment of the patient's problem, personal qualified non-physician healthcare professional interaction with the clinical staff focused on the patient's problem, development of the management plan, including the generation of prescriptions or ordering of tests and subsequent communication with the patient through online, telephone, email or other digitally supported communication. All qualified non-physician healthcare professionals in the same group practice who are involved in an online digital assessment contribute to the cumulative service time devoted to the patient's online digital assessment. And the qualified non-physician healthcare professional online digital assessments require visit documentation and permanent storage. Visit documentation and permanent storage, for example, electronic or hard copy of the encounter. And if the patient generates the initial online digital inquiry within 7 days of a previous treatment or E&M service or both services related to the same problem, or the online digital inquiry occurs within the post-operative period of a previously completed procedure. In all these cases, the qualified non-physician healthcare professional online digital assessments may not be reported separately. The first case is within the 7-day period if there is any previous treatment or E&M service or both, or if the patient is within the post-operative period of a previously completed procedure. In all the 3 cases, you cannot report these codes separately. And if the patient generates an initial online digital inquiry for a new problem within the 7 days of the previous service that address the different problem, then the qualified non-physician healthcare professional online digital assessment is reported separately. If the problem is new within the 7-day period of a previous service that addressed a different problem, then you can report the code separately. And if a separately reported E&M service occurs within the 7 days of the qualified non-physician healthcare professional's initial review of the online digital assessment. Codes 98970, 971 and 972 may not be reported. If a E&M service occurs within the 7-day period of these services, you cannot report these services, which are reported by the CPTs 98970, 98971 and 98972. If the patient presents a new unrelated problem during the 7-day period of a online digital assessment, then the qualified non-physician healthcare professional time spent assessing the additional problem is added to the cumulative service time of the online digital assessment for the 7-day period. If within 7-day period, 2 online digital assessments are done by the qualified non-healthcare professional, then the time spent assessing the additional problem is added to the cumulative service time of the online digital assessment for that 7-day period. Now let us see the CPTs. There are 3 CPTs in total: 98970, 98971 and 98972. 98970 deals with qualified non-physician healthcare professional online digital assessment and management for an established patient up to 7 days. The cumulative time during the 7-day period should be 5 to 10 minutes. If the cumulative time during the 7-day period is 5 to 10 minutes, you can report 98970. If the cumulative time during the 7-day period is 11 to 20 minutes, you can report 98971. And if the cumulative time during the 7-day period is 21 minutes or more, then you can report 98972. These are the 3 CPTs regarding the qualified non-physician healthcare professional online digital assessment and management services. What code would report an internal assessment and management service provided by a qualified non-physician healthcare professional to an established patient not originating from a related assessment and management service provided within the previous 7-day period? Here, internal assessment and management service is provided to a established patient by a qualified non-physician healthcare professional, and the time spent, cumulative time spent within the 7-day period is 7 minutes. So the appropriate CPT is 98970. Qualified non-physician healthcare professional online digital assessment and management for an established patient up to 7-day periods. Cumulative time during the 7-day period is 5 to 10 minutes. Here the time spent is 7 minutes. So this comes under the range 5 to 10 minutes. So the appropriate CPT is 98970. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.